right. We are back for part 2 of the video on our weight management chapter. So we're going to pick up right where we left off. We began talking about ways to measure or assess body composition and health. And body mass index is probably the most common. So as I said in the previous video, there's a lot of accuracy problems with body mass index. It's not very accurate in many ways. However, it is used very commonly because it's easy, and doctors and researchers can use it because it's easy and we have a large number of people. It's pretty much the only way you're going to be able to get any data like this. So we're going to talk about what body mass index is. So we can calculate BMI through a formula, which is your weight in pounds times 703 divided by your height in inches squared. So we can just do a formula. You don't need to know a specific formula. You just have to know that a formula exists. Or the more common way to measure BMI is a simple chart. And this is going to help us consider what it is. So basically we have height on the y-axis and weight on the x-axis. So it's basically a height and weight chart with numbers in the middle. Okay, so I'll use myself as an example. I'm about 150 pounds, so I come down the 150 and I get to my height, which is between 5'8" and 5'9". So let's just say I'm about 24, right? Oh, that's the wrong one. Sorry, see? Gotta make sure I'm doing this correct. Come down to 150 if I'm 5'8". So my BMI is 23. And as the colors suggest, the red is the healthy weight. So if I was heavier and I weighed more, but I was still 5'8", my BMI would be higher. And in that way, I'd be classified as obese. So no matter if you use the chart or the formula, body mass index is basically a height and weight chart. And it gives you a number. The normal BMI range is 18 to 25 or 18 to 24, I think most people would say. So my previous one was, 23. So I'm kind of at the higher end there. If you're over that range of 18 to 24, you're considered overweight or obese, right? Between 25 and 30, you're overweight. 30 plus, you're obese, right? So the green shades are overweight and the yellow shades are obese. On the other end of the spectrum, someone could be classified as underweight, which is the blue. But 18 to 24, 18 to 25 is the norm, based on this. As you can see, I've got one pro, it's easy. And you know, I hear the researchers out there that are studying hundreds of thousands of people. It's perhaps the only way to do it, but I still would say there's got to be other ways. What are the cons? The biggest con I want to point out, it does not take into account age, gender, or body type. Age, as we get older, our metabolic rate, our basal metabolic rate goes down, so we tend to hold on to more weight. This doesn't reflect that. Gender, men and women store weight differently. Women have more body fat because women are all about being built for childbirth. This doesn't account for that either, having more body fat as a norm for women. And also body type. So I'm going to give you some examples, right? I'm going to give you an example. Here we have two potential people, same age. Let's say they're both 35. They're both 6 feet tall, and they're both 220 pounds. This poor guy on the right, I just got his picture off the internet. But the idea here is this guy has more fat mass This guy has more, just going to ignore that. This guy has more lean mass. But the total weight is the same. Well, based on just the BMI, because it doesn't take into consideration type of body tissue, they're both considered obese, right? So this chart does not take into account what type of weight it is. In fact, folks, muscle weighs more than fat. 220-pound guy could be really full of muscle. Or 220-pound guy could be full of fat. So that's my biggest beef with this. According to this chart, this guy would, on the left, would be shown as obese. Okay. I'm encouraging you, right? Now that you know about this, now that you know about BMI, speak out about it. If someone, I've had students tell me that the kids in school, the nurse or the doctor at school, whatever, the nurse will use BMI, and if it's over 25, they'll send a note home to the kids saying, your son or daughter is overweight. Oh, dear. Well, using that chart, maybe it's just a bigger person. Doesn't necessarily mean that they're overweight. I like to say the eyeball test. And furthermore, that's just sending home a note based off BMI. It's not really a helpful way to do anything. So, things to think about. There are better ways to do it. And the better way to do it is to consider type of weight. Lean mass versus fat mass. Lean mass. Make sure you can define lean mass. Lean mass is the lean tissue, muscles, bones, and organs. Your lean mass is your muscle, bones, and organs. Your fat mass is your fat, your adipose tissue. Your total mass, your total weight, is equal to your lean mass plus your fat mass. Ideally, it's better to have more lean mass and less fat mass. Now, we obviously need some fat mass. We need some fat mass. Fat serves a lot of important functions: long-term energy, insulation, protection. But we don't need an excessive amount of fat mass. Here are some ideas of how that should work out. We've looked at, when you look at fat, you can actually talk about essential fat, and we can see it in men versus women. Women are the purple, so women are going to have more fat. Women are going to usually have less muscle, and that's just the way that our biology is set. What I do want to talk about is it's not just the overall fat. Overall fat matters, but it's also the location. The location of fat is also a consideration. So we have to consider both the amount of fat and the location of fat. So you can see these pictures here. In a healthy weight person, some fat is stored around the organs, but not too much. In an overweight, we can have an excess amount of fat between the organs. Let me make it yellow. We could have an excessive amount of fat between the organs, but you can also have an excessive amount of fat outside of the organs, under your skin. This is what I'd like you to know, and I think a lot of you already know this, but men and women store weight differently. Men tend to store more of their fat mass. I'm talking about fat. I think I have to sneeze here. I apologize. There we go. Men tend to store more of their fat mass in their chest and their belly. Women tend to store more of their fat mass in their hips and their thighs. So we can see the apple versus pear shape. These both carry different risks, right? Because of where men are more likely to carry their fat mass, men may have a higher risk of heart disease. Women have a risk of other diseases, usually, right? So I'm not going to ask you the risk of heart disease for men specifically, but I would like you to know where men versus women tend to store their fat mass. Okay, so we're going to talk a lot about measurement techniques. So we talked about the BMI. That's not an assessment of body fat percentage. The BMI is just an assessment of overall health based off of a height and weight chart. We can also look at other measurements for health. We are going to talk about the body fat percentage measurements, but there's also other pretty easy measurements that we can do for health purposes. And these, particularly the waist to hip ratio, these give us a better idea of health. The BMI simple height and weight chart, right? I would suggest for those researchers or whatever that don't have a lot of resources who would usually use BMI, which you could also do waist to hip ratio. So just know what these are and what some of the pros and cons are. Waist to hip ratio is exactly what it sounds like. We take the circumference of the waist. For men or women, it's the narrowest part. And then we take the circumference of the hips, which would be the widest part, narrowest part to widest part. You do the math, and these are some normal values. I'm not going to ask you the normal values, but just know that normal values exist. Whereas the BMI is just looking at overall height, overall weight, here we're getting some kind of ratio of how the fat and how the weight is distributed. And that can give us a little bit more information. It's not perfect. Of course it's not perfect. But if I looked at those two men that were both 6 feet tall and 220 pounds, their BMI was the same, but their waist to hip ratio would not be. So that's why I say it's a better way than BMI, but still has some issues. What this is supposed to tell us is if the ratio is above a certain amount, it is considered to tell you if you're at a higher or lower risk for cardiovascular disease. It gives us more information than the BMI, but still not great because we're only measuring one region. Now, probably the best way to get an assessment, overall weight gives us one number, but it doesn't tell us the type of mass, lean versus fat. The best way to differentiate lean versus fat is to measure body fat percentage. So if you go back to those 220-pound men, the athlete is going to have a much lower body fat percentage, telling us that most of his weight, or a larger amount of the weight, is muscle, healthier, versus the other dude, 220 pounds, but he's not athletic or muscular, so it's a much higher amount of fat. We're going to go through some ways to measure body fat percentage. Excuse me. And we'll talk about the pros and cons for each. Now remember, the previous ones did not measure body fat percentage. They were maybe a way to measure overall health in some way, but here we're talking about actually measuring body fat percentage, identifying fat mass versus lean mass. Okay, we are going to talk about the gold standard ways to do the body fat percentage, hydrostatic weighing, and now the bod pod. But they're expensive. They take training to set up and run. They take more time, perhaps, to carry out. All right, so these are the two gold standard ways. In fact, we're now relying more on the bod pod. We have one on campus, actually, at St. Valley Community College. It's a little oval pod that you sit in, and before you sit in it, the machine knows the specific volume of air inside of that capsule. When someone sits in it, they displace a certain amount of air, and the machine is able to measure amount of air displacement. The more fat someone has, the more fat mass someone has, the more air they will displace. We used to use more hydrostatic weighing when I was in college 20 years ago. We used this. It's the same idea, but instead of measuring air displacement, you're measuring water displacement. It's like doing the cannonball, right? The more fat mass someone has, the more water gets displaced. You should be able to understand how each of these techniques measures body fat percentage. So the hydrostatic weighing measures water displacement. The bod pod measures air displacement. Okay, here's a more up-close look. Again, I'm so sorry. All right. We can also, another very accurate tool, but probably even harder to get your hands on to use, would be a DEXA scan. It's basically a full body x-ray. So this little unit travels all the way across your body and it measures density of your tissues. This is a great way, and actually you might be able to ask your doctor, can I get a DEXA scan? Particularly for women, this can also give us our bone density. So as women age, they tend to lose more bone density, and how they will measure that to see if they are approaching osteoporosis is through a DEXA. It says here it's not considered to be as accurate. I think the scales are changing a little bit. This is becoming a very accurate way. So we like this one. DEXA scan. Sends a special x-ray. It measures tissue density. Other ways, the good old-fashioned skin fold calipers. These can be reasonably accurate, but the problem with this is that you need someone who's experienced to do it. So, the calipers themselves can cost you $10. Well, that's easy. But you need someone with the proper training to do it. So the room for error is much higher. Maybe you've heard of something called the bioelectrical impedance unit. Sometimes it's shortened as BIA. This one, you put your hands on these silver areas and it sends a small electrical current through your body and it measures the resistance to that, right? This is very easy. People like it. A lot of gyms around town will have it because it's cheaper, it's cool, but it's not the most accurate. And this one the BIA is very susceptible to hydration changes. So if someone comes in over or under hydrated, it will throw off those numbers. So again, you should know each of these techniques and you should know how they are done. You should know which is the most accurate and which is the least accurate. Okay, what is a healthy body fat percentage? Well, there's not necessarily one right answer, but we can give a range. And we can give a much more specific range than we could for what's an ideal weight for someone. So for college-age individuals, these are the healthy ranges. College age, adult males, the ideal body fat percentage is between 10 and 20%. And for college-age females, the desired body fat percentage is 20 to 30. Now, I have some of my friends who look at this 20 to 30 for adult females, and they say, they'll tell me, Dr. J, there's no way that I'm 28% body fat. Really? And I'll say, yep. So women, it's absolutely expected. It's how our biology is put together that we will likely, in many instances, have twice, in some instances, twice the body fat of men. And that's normal because that's what our hormones tell our body to lay down more fat. It's not necessarily a bad thing. Now, it can get out of control, but sometimes women, you just have to embrace that. This is what I'm saying here. 30 seems so high. For a lot of adult women, 30%, it falls within that range. You're doing okay in terms of health. You know the potential negative consequences of too much body fat. I don't even need to list these, you know. So when we look at too much weight, our ability to differentiate fat mass versus lean mass, too much fat mass in particular, that's the culprit, right? Then there are some things that you may not know are related to having too much fat mass. So have a look at those. Yes, cancer. Did I read that carefully? Cancer? Those that have a higher body fat percentage have a higher risk of developing cancer. Now, a lot of cancer is the risk of someone getting cancer is genetic, partially. It is environmental. It's our lifestyle. But indeed, you know, if you have a genetic link to cancer, you're not going to be able to change that. But if you are a healthy weight, healthy body fat percentage, your body's going to be much better able to fight against that risk of cancer. Okay. So the obvious question is, if we know that too much body fat is bad, why do so many people continue to be sedentary and eat in excess? I don't have the answers here. I don't have the answers. I'm just laying it out. You know, nutrition is a really hard thing to change. It's a hard thing for us to change. But I think it's worth having the conversation because what we eat absolutely impacts our life, our health throughout our life. Okay, so we're coming towards the end here, and we're going to talk a little bit about how to lose weight and then how to gain weight. Lose weight. We talked a lot about this basic formula. Even though it's a little bit more specific, in most instances, someone can lose weight just considering this, right? To lose weight, if you reduce calories in and then you increase your activity level, you're going to lose weight. What are some of the specifics? To lose 1 pound of body fat, you need a deficit of 3,500 kilocalories. Think about that. It's going to be hard to lose that pound of fat. Now we're talking about to lose a pound of fat. You could easily lose a couple pounds through fluid, you know, just by not eating as much, not drinking as much, fluid fluctuations. But I'm talking about losing a pound of body fat. Think about that next time you grab the ice cream. So we need a deficit of 3,500 calories to lose 1 pound of body fat. And it doesn't have to be all in once, not one day. That would be ridiculous. Over the course of a week. Right? Over the course of 10 days. Let's do that one. Over the course of 10 days, if I take out 350 calories a day, that's doable. Then over the course of 10 days, if I reduce my intake, or I have a deficit of 350 calories, if I do that times 10, I'm going to lose a pound of body fat. Excuse me again. Something I want to point out is when we lose or gain fat, the adipose cells, the fat cells, they increase in size, not number. So we're more or less born with a certain number of fat cells. So those fat cells can get smaller or they can get bigger, right? But we more or less increase the size of the fat cells that we have, not necessarily the number. Here's a picture of that. Same number, they just get bigger or smaller. It's actually the same principle when it comes to muscle. We have a genetically determined number of muscle cells, and what we do with them, we either increase or decrease their size. Okay, so how to lose weight. As I said, we need to expend more calories than we ingest, but we cannot deny that there's got to be a psychological aspect to it, right? If you don't address the root cause for someone, and I'm talking about those who really overeat or whatever, you need to address the psychological component. The textbook lists 3 ways, right? So your textbook says, well, if you're going to lose weight, you need to address all 3 aspects. You need to reduce your calorie intake. You need to increase your activity level. But it's also that behavior modification. And I would argue that the psychology falls within that. To permanently alter your behavior, you have to consider the psychology. All right, some things to remember for a healthy diet. All I'm asking you to know are the things that are in bold here. Eat foods of lower energy density. That would be good. Right, we talked about that already. Here's some examples. Increase your physical activity. This is the start line. I can't believe it's been so long. This is a 2010 Ironman. I'm in there somewhere. Increase your physical activity. And then look at your behavior modification. This is the hardest. It's most difficult, of course, because this is what's really going to help you continue it over the long term. And of course, you have to address the psychological factors. There tends to be kind of a negative feedback loop where someone feels fat and unhappy. They want to feel differently. They think they're going to lose weight, but then they set an unrealistic goal, and then they end up eating more, and it's a negative cycle. What are some things that can get in the way? You can read through this. I'm not going to actually go through this specifically. This is just some information for you if you're interested. What I would like to point out are some successful strategies for those who are interested in weight loss. Set goals that are realistic. Don't say I'm going to lose 10 pounds in this first week. You're setting yourself up for failure. So set realistic goals. The ideal weight loss is about 10% of your body weight over about a 6-month period. For most people, what that breaks down to is 1 to 2 pounds per week. This is a healthy rate of weight loss, losing about 10% of your body weight over 6 months, or 1 to 2 pounds per week of weight loss. These are reasonable rates of weight loss. All right, so we have a couple of miscellaneous topics. Here we go. Fad diets. At the very beginning of the semester, I talked about asking you to be a skeptical consumer. These people want to make money, and that's their goal, not your health. Something that claims something really outrageously good in so quick of a time. If it sounds too good to be true, it usually is. They oftentimes don't address the real problem, and they're not going to lead to long-term success. Here are some examples. I am not going to ask you about these. I'm not going to ask you about gastric bypass. It's here if you want to read it. What I do want to mention is, on the other end of the spectrum, some people have a hard time gaining weight. That certainly was never true of people in my family or me. But some people have a legitimate problem gaining weight. This could be just for genetics, just how they are. It could be after surgery or after something like that, where they really need to gain weight for their body's health. It can be just as challenging. I give you some suggestions here at the bottom. You don't have to know all of these suggestions. They're just here for your benefit, right? So here are some good examples. You don't have to know these. I actually got this from a friend who is someone I met when I was getting my PhD, very good guy. He knows a lot about this stuff. So if you really want to learn how to gain lean mass, it's potentially easy to gain fat mass, but wouldn't it be ideal for anybody to gain lean mass? So you can read about some very legitimate strategies. It can be hard, but these are some really good tips for you. Then I give you some sample foods. Make sure you review some basic definitions: disordered eating or an eating disorder. Technically, an eating disorder is an illness that is defined by psychologists in the DSM, the Diagnostic of Statistical, what is it? DSM? No, isn't it on here? Oh, I forget. But this is like a clinical situation that is diagnosed, versus disordered eating are patterns that can lead down to this, right? So disordered eating is just more of an unhealthy pattern, versus eating disorders would be something that's a little bit more severe. But I do want to point out this bottom here, even though these are specific definitions, quote unquote, people don't have to fit into a specific definition to have some sort of disordered eating. And this is a topic that's kind of taboo. Once we start to talk about these specific things, it kind of scares people away. So there it is, the Diagnostic and Statistical Manual of Mental Disorders. Right. Okay. Anorexia, make sure that you can define these. Anorexia is purposely restricting calorie intake. Bulimia is binging often or eating large amounts and then throwing it up. There are some others. Binge eating without throwing it up, and then night eating can also be a negative. Just know the top two definitions. You don't need to know all the specific criteria, but just the basics. Here we go. Anorexia is like self-starvation. You can read about it. Bulimia is when you eat a lot more and then throw it up. Binge eating is when you binge eat without throwing it up. Okay. I've just given you a lot of information here. I'm not going to ask you about the specifics. We just have some general information for you. In terms of treatment, I am not an expert. This is something that hopefully you would want to reach out to experts in health, in mental health, to help someone who is struggling with this. There you go, folks. A lot in the end we just covered and was there for your information, but make sure you know the definitions of what I pointed out. All right, good job.